Hi, my name is Tiara Jessup, and I am a candidate for a Master of Public Health degree with a concentration in health promotion. Over the course of my time at Liberty, I've had a passion for maternal and child health, especially postpartum care and breastfeeding. On the next slide, there is a list of items that will be discussed during this presentation. These are discussion of Family Connect site, purpose of Practicum, data collected, along with accomplishments achieved, recommendations, and final remarks. Next slide. Because of God's grace, I have been fortunate enough to obtain an internship with Family Connects, a universal home visiting program held at Forsyth Medical Center located in North Carolina. Family Connects offers integrated home visits approximately 2 to 3 weeks after delivery or after hospital discharge. During the visits, a nurse conducts newborn health assessments, postpartum assessments for the mother, provides supportive topics relevant to the needs of the mother and the newborn, provides specific education and demonstration to respond to mother's questions and concerns that arise from observations. Use of family support matrix to discuss areas concerning family support, strengths, vulnerabilities, and needs. On the next slide, you'll see an illustration of the family support matrix used during the home visit, which provides 4 domains and factors associated with maternal and child well-being. The diagram lists goals and areas concerned ranging from no concerns at all to situations potentially requiring emergency responses. One of the most important areas of the matrix is support for parents. Oftentimes, the parents are left out when considering care for the infant. With Family Connects, this is completed collectively. Next slide. One of the final duties conducted during the integrative home visit is offering recommendations and referrals to community services as selected by the nurse, visitor, and parent. Some of the most commonly recommended sources were Welcome Baby, Diaper Bank, Labor Ladies, Imagination Library, WIC, Child Care Resource Center, and more. The Imagination Library offers a free book a month to children from birth to age 5. This is a great initiative created by Dolly Parton. The parents receiving these resources have the option to contact the agency themselves or to allow the nurse to send a referral on their behalf. Next slide. My purpose at the Practicum site was to attend nurse home visits, perform observations on performance at the visits, as well as assessing the resources offered. I made goals to attend at least 10 visits, but due to patient cancellations, I could only attend 5. My primary project consisted of data collection, analysis, and creating visual aids on the parameters associated with postpartum depression. I hand-collected data for over 1,000 women who delivered babies at Forsyth Medical Center during the months of July 2018 to December 2018. During my data collection, I discovered the barriers and limitations of data collected and how important data collection is in a community-based setting. I analyzed 7 parameters including age, race and ethnicity, insurance status, number of kids, number of spontaneous abortions, prenatal care, and Edinburgh postpartum depression scores. With these parameters, I was able to make conclusions about common trends between women of various backgrounds, like the onset of prenatal care among the Hispanic population and comparing it to the onset of prenatal care among the African American and white population. Most of the visuals consisted of illustrating what the data represents. For instance, how many women suffered from previous spontaneous abortions during the month of October. The month of October was one of the largest months that Family Connects had in the year 2018. On the next 2 slides, there will be visual aids collected during my internship showcased it. The first chart illustrates the racial and ethnic differences among the women using Family Connects services. The second slide is a pie chart that illustrates the percentages of Edinburgh scores ranged for women in Family Connects. It was discovered that at least half of the women seen did not have issues with postpartum depression. I found that range and that percentage to be very, very good. The next slide lists some of the things performed with outside agencies during my time with Family Connects. I attended professional events and meetings as an individual, which made me feel a part of a team. The Bridges Out of Poverty event took place on April 5th, which allowed me to gain a deeper insight on the need for resources and communication as a society. Meetings with WISH, The CARES Project, the Parenting Partnership, and VROOM were attended. I met with a representative from WISH on my first day. Another opportunity I had was to attend a quarterly community advisory board meeting with my preceptor to showcase the purpose of Family Connects and how to get clients referred to the services offered upon child delivery. I've been invited to attend the next CAB meeting in July to illustrate my work with Family Connects, essentially showcasing the work of the 9 nurses, nurse manager, and the community resource specialist. I look forward to it. Next slide. Some of the accomplishments achieved were using the Family Connects database and EPIC system to navigate through charts in order to collect data. I kept a 17 to 30 page long patient list profile for each month on hand while collecting data. Each individual chart was assessed according to family demographics, postpartum care, infant profiles, and the screenings completed. Some of the charts required further assessment and search due to missing data, which was noted to be a limitation during a data analysis operation. After completion of analysis, all material was then transferred into Excel for processing. Next slide. It is with great hope that this program continues to expand throughout the state of North Carolina. The organization has added another county to the list, which I've been able to assist with by creating home visit packages. When I started my internship, Family Connects only existed in 2 counties, Durham County and Forsyth County. As of a month ago, the organization has been able to expand their services to Davidson County, which is also located in North Carolina. Some of the objectives established by my preceptor and I were, by July 2020, there will be a scoring breakdown of the parameters mostly affected by Family Connects women. By July 2030, postpartum depression rates will have decreased by 15% due to more home visits and support provided by Family Connects, the Public Health Department, and other local agencies across North Carolina. Next slide. As an intern with the organization, I've had the opportunity to witness a mother's agony when she's faced with a new life in her hands, all while continuing to take care of her own. I've been able to observe women who have had multiple questions during an observation, multiple things that they would like for the nurse to help them with, and they did not know the resources were out there. Family Connects serves as the gap between a new mother after hospital discharge and the community. After my experience with Family Connects, I recommend all expecting and mothers of young children to get to know the resources available in the community. There is a need for reducing postpartum depression and providing peer support. Available resources is viewed as the most common method of reducing incidences. Some further recommendations that I have to give are to expand the length of visits from 2 weeks postpartum to 5 weeks. Women appear to have more questions and concerns weeks after delivery as well. Ultimately, the goals and objectives for this home visiting program are being met, and I've been blessed to have experienced such a great time and connection with such amazing staff. I thank you for watching my presentation.